green line is the capsule of the joint by the brachialis. These are the anterior relation. Now the posterior relation. In posterior relation, the tendon of triceps, anconeus, and the nerve to anconeus. And the medial relation. In the medial relation, the medially which bone is present? Ulna. So the flexor carpi ulnaris, common flexor origin, and ulnar nerve. As I have told you that the ulnar nerve is related with the medial epicondyle of the humerus. So medial bone is the ulna, and so it is present on the medial side. Now the lateral relation of this joint is the extensor carpi radialis. Laterally which bone is present? Radial bone. So the radial bones related, they are on medial side are the flexor muscles, while on the lateral sides are the extensor muscles. Extensor carpi radialis brevis and the common extensor. Here are the common flexors on the medial side and the common extensor on the lateral side. It is very important and a relation according to the, they can ask regarding the injury. If the elbow joint injured anteriorly, these structures should be affected, and posteriorly these structures and this nerve, especially the nerves, are very important for regarding the BCQs. Movements. Now the movements, I have told you that in the elbow joint only two movements take place, the flexion and extension. The flexion is produced by these muscles. These are the muscles of the anterior compartment, the brachialis, biceps, and brachioradialis, while the extension is occurred by the posterior compartment of muscle, that are the triceps and anconeus. So what is carrying angle? I have told you that the transverse axis of the elbow, this axis, this is not straight, this is some little bit lower than, this is in oblique form. So it is because because the medial flank of the trochlea is about 6 mm lower than the lateral flank. So when the elbow is extended, the arm, and this is the arm, this is the forearm, they are not in line, they are not lie in straight line. Rather, forearm is deviated slightly laterally. You can see this forearm is deviated to the laterally. This is the diagram showing laterally. This angle of deviation of long axis of forearm along with the long axis of the arm is known as the angle of carrying. This angle disappear when you pronate. आप करके देखो, अगर हाथ को ऐसे नीचे ऐसे सीधा कर दो तो हाथ बिल्कुल बाजू बिल्कुल सीधी हो जाएगी. When it is pronated in position, the angle will disappear. The carrying angle, what is the value? Varies from 5 to 15 degree and is more pronounced in female because of the female has a wider pelvis. अगर यहाँ पे ये wider ना हो तो जब पानी भर के औरतें जो बाल्टी में ला रही होती हैं तो आधा पानी इससे टकरा के ही गिर जाए, तो बेहतर, तो इसलिए नेचर ने इसको इनके वाइड एंगल ऑफ दी इसकी पेल्विस की वजह से इनका ये जो एंगल है वो ज़्यादा होता है ताकि इससे बार बार टकराए. द वाइडर carrying angle in female avoid rubbing of the forearm with the wider femur pelvis while carrying load, for example bucket filled with water from one place to another. So now the some little about the clinicals of the, they are very important. The elbow joint dislocate mostly posterior in dislocation, very important. तो posterior में इसके relation कौन से थे? ये relation थे tendon of triceps, anconeus, which nerve to anconeus. These are the posterior relation. When it dislocate, यहाँ देखो ना कैप्सूल की भी complete नहीं है, इसी वजह से ये it dislocate, mostly it dislocate posteriorly. Now the nurse made elbow or the pulled elbow subluxation of the head of the radius. In preschool children 1 to age क्या है 1 to 3 years. अगर हाथ ऐसे अचानक खींचो, when the forearm is suddenly pulled in pronation, ऐसे जल्दी से सीधा ऐसे करो तो वो slip हो जाता है. The head of the radius come out of the annular ligament because head of the radius is present in the annular ligament. तो जैसे एकदम उसको pronate करोगे बच्चे की बाजू को तो उससे बाहर निकल आएगा, ठीक है. तो इससे सीवियर, जब आप दोबारा सुपिनेट करना चाहोगे तो सीवियर पेन होगा. टेनिस एल्बो, व्हाट इज टेनिस एल्बो? इट इज वेरी 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 इंपॉर्टेंट. The another name is the lateral epicondylitis, mean the inflammation of the lateral epicondyle. So the tenderness or pain in the lateral epicondyle during the pronation, it occurs due to the which ligament is attached on the lateral side? The lateral collateral ligament of the elbow. Laterally is the which bone is present? Radial, meaning radial collateral ligament, and tear of the fibers of extensor carpi radialis brevis, जो मस्तिष्क रेडियली अटैच है. एंड अगर बर्सा की एक्सटेंसर कार्पाई रेडियलिस ब्रेविस की बर्सा की इन्फ्लामेशन हो, तो ये वो वजह है जिसकी वजह से, और ये अक्सर उनमें ज़्यादा होता है जो टेनिस खेलते हैं, इसलिए इसको कह दिया है lateral epicondylitis is also known as the tennis elbow. Now the golfer's elbow is also known as the medial epicondylitis, in which the inflammation and tenderness occur on the medial epicondyle of the humerus, and it occurs on the lateral epicondyle. The common extensor are attached, and in the medial epicondyle the common flexors are attached. So the tear of the common flexors origin occur. Okay, and it occurs mostly during the playing of golf. This are called the golfer's elbow. The student's elbow. आप जब पढ़ते हो तो अपनी ये कोनी ऐसी जो है elbow की ऐसे नीचे ज़्यादातर ऐसे नीचे रख के पढ़ते हो, तो दबती है तो ज़्यादातर ये बरसा जो सबक्यूटेनियस और क्रेनियल बरसा है वो इसमें प्रेस होता है, जिसकी वजह से उसमें इन्फ्लामेशन होता है. सो द स्टूडेंट्स एल्बो में इज आल्सो नोन एज द माइनर्स एल्बो, एंड इन विच द swelling occur in the olecranian process, and it is due to the inflammation of this important point is very important. It is in the student's elbow which bursa is inflamed, subcutaneous olecranian bursa. Now you can see this is the radial collateral ligament, and this is annular ligament, and this is the मैंने जो पोजीशन आपको बताई थी कि भी बाजू बच्चे की ऐसी खींची तो उसमें क्या हुआ कि वो head of the radius come out from the annular ligament. Pulled elbow. Now this is the lateral epicondylitis, mean tennis elbow, and this is the medial epicondylitis, golfer's elbow, and this is the student's elbow. ये पाँव नहीं है, ये बाजू को ऐसे नीचे करके पढ़ना है, ठीक है. माइनर्स और स्टूडेंट्स एल्बो में किस चीज़ की बरसा, कौन सा बरसा है? सबक्यूटेनियस ओलिग्रेनियल बरसा की इन्फ्लामेशन होगी. Now the nerve entrapped in the compression around the elbow joint. This is the median nerve, passes between the two heads of the pronator teres. So when any inflammation or any atrophy of this muscle, it also causes the compression of this muscle, nerve. So the median nerve can compress in between the two head of the pronator teres. And other which side? This is the flexor digitorum superficial part. It is reflected part. Cut करके दिखाया. The below this is the median nerve. So median nerve can also compress below this flexor digitorum superficialis. And the another point site where the passage and this is the carpal tunnel, and this is flexor retinaculum, and the median nerve passes below this retinaculum. So when there is inflammation or any edema occur, the median nerve compress here in the carpal tunnel, which give rise to carpal tunnel syndrome. And the ulnar nerve which passes from behind the medial epicondyle. This is the first site where the compression of this nerve occur. So the first site is the posterior to the medial condyle or epicondyle of the humerus, which is the commonest site. And the other side where it passes through the cubital fossa. In the cubital fossa, by tunnel by tendinous arch joining the humeral and the ulnar head of the flexor carpi ulnaris. This is the flexor carpi ulnaris. This is flexor carpi ulnaris, and this is the flexor pronator. So it can be compressed in between two muscles when the atrophy of these muscles occur. This is all about the elbow joint. In elbow joint, the carrying angle and the nerves relation and compression. It is tennis elbow, student's elbow, golfer's elbow. They are very important. And the type of the joint, which bones take part in the formation of this joint, and also the ligaments of this joint, with which nerve is related with the medial collateral ligament. These all points are very important. Thank you.